What's up, guys? Welcome to episode 52 of the Unofficial NCLEX podcast. My name is Katie Kleber, and the title of this episode is Make Appropriate Room Assignments for Cognitively Impaired Patients. So let's chat a little bit about this. This is code for put the confused patient near the nurse's station. Simple as that. If you have a patient that they're confused, demented, maybe they are withdrawing from alcohol or with something, maybe they're not, you tell them, hey, let me know when you need to go to the bathroom, and they hop up and they're impulsive. You want that patient as close as possible to the nurse's station, because if you have a room where maybe if you're at the nurse's station, you can have an eye on them, or if you hear them calling out for something, it's much easier to address that if they're close to the nurse's station, comparatively if they're at the end of the hallway or no one hears them, no one routinely walks by that room to just kind of peek and make sure everything's okay. Really important to do this, guys, but keep in mind it's not always possible. I've had times where we're like, okay, we're going to actually move patients rooms in the middle of the shift to move them closer to the nurse's station because we're concerned about them falling, injuring themselves, maybe ripping out IVs or whatever. So we'll move them closer to the nurse's station. But sometimes you have those situations where you've got more confused patients than appropriate rooms. Hopefully that only happens far and few between for you, but you just want to try to get as many people that are confused as close as possible to the nurse's station. And we actually, what we'll do on our unit, a couple units I've been on, and I think this is a great idea, is we kind of keep the rooms next to the nurse's station open unless we know that and save those really for the confused patients. So if I'm getting a report on a patient that had a routine surgery, completely alert and oriented, has family that's with them all the time, I feel a lot better about them having those rooms that are farther away from the nurse's station. So I'll routinely put them in those rooms. And then when I get a report and it's like, the patient's confused, they keep trying to get out of bed, they fell yesterday, that patient gets front row treatment here. I'm putting them there if I can. So I think that's kind of a wise thing to do. That way you're not having to move two patients later on and move one out of a room to kind of inconvenience them and have to clean the room and do all that, kind of a headache. So if you can kind of forward think and kind of, okay, I have these rooms that are closest, I kind of save those for my confused patients. It can save you quite a bit of a headache and some work as well. So keep in mind, you always want your confused patients as close as possible to the nurse's station, so more people are routinely walking by, and even if they don't visualize, the patient, at least they can hear if the patient's calling out. Patients, they have their call lights. Not all of them understand how to use them. So, you've got more likely that someone is going to hear if they need something. So, it's pretty straightforward. Just make sure those confused people are as close to the nurse's station as possible. So that concludes episode 52. Make appropriate room assignments for cognitively impaired patients. Thanks for listening, guys.
This has been another episode of the Unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEXprep. That's nrsng.com/NCLEXprep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of nrsng.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.